We in the United States are in a mental health crisis. And when we talk about students in America, it is impacting educational outcomes. In Michigan, dramatically as well. One new report actually says that 66% of students in Detroit are chronically absent. So what do we do about it? Well, there are three folks who are joining me now who are thinking a lot about the issue. We have Laura Huot, President and CEO of the Guidance Center. Great to have you. Dr. Nikolai Vitti, he of course is Superintendent of the Detroit Public Schools Community District. And James White, President and CEO of Detroit Wayne Integrated Health Network. Laura, I want to start with you. You lead the Guidance Center, which provides a wide range of behavioral health services to children and to families. From your experience, what is the most significant mental health challenge that is contributing to truancy right now in the state?
I think some of what happened during the pandemic and kids being away from school for so long contributed to that. We also have a lot of families that we work with, single parent homes where there's not a lot of structure in the home, and that makes it difficult to reinforce the kids going to school. But we do have a program, youth assistance program, and multiple nonprofits in Wayne County have this program where we focus on kids when there are issues like truancy or other at-risk factors and try to make sure that they're attending regularly and follow up with their families and provide all kinds of other supportive services. So we believe children need to be in school and they need to be able to and ready to learn.
And of course, so does the superintendent. And you're doing some work within the district, Dr. Vitti. How are you thinking about and addressing the mental health challenges that we're seeing that are just contributing to students simply not showing up to school?
Yeah, well, when I think about some of the greatest challenges that we have as a school district, it's chronic absenteeism certainly toward the top. It's sort of cliche, if you're not at school, you can't learn. But when you just look at our students and the data, when students miss 18 or fewer days of school, they're 3 to 5 times more likely to be at above grade level in reading, math, or to be college ready. So we know that we're doing the right things in the classroom, and it's been a journey in improving systems, processes, recruiting, retaining teachers, but we're doing all that much better. We just have to have the kids show up more. So one of the main reasons, as you've already indicated, is mental health. So as a district, we've done a lot, and I think we're really leading in a lot of different ways across Michigan in what we're doing with our students. All of our students take an at-risk adverse survey at the beginning of the year, 3rd to 12th graders, and that survey is research-based to determine what challenges are students facing, from anxiety to fear to depression, based on the trauma they've experienced. From there, we can identify the students, and then we have mental health support now in all of our schools contracted. So when students take that survey and a red flag is raised, we can connect them to one-on-one or small group therapy as long as the parent signs off on that. And I think that's gone a long way to providing direct support. And then we've developed health hubs now across the city, free access to mental health support for families and students, free dental, medical, and vision screening aside from mental health. But those are just some of the ways we're starting to attack the issue, and I think it is making a difference when we look at chronic absenteeism. We got a lot of work to do, but finally at the end of this school year, we're finally going to get back to at least pre-pandemic levels with average daily attendance and chronic absenteeism. But I think we're moving in the right direction.
James, you oversee the public mental health system in Wayne County. From your perspective, what does this mean for the, not just schools and absenteeism, but for the community at large?
Yeah, it's important for all of us. We often say the kids are our future. The kids are right now. So we need to make sure we do everything we possibly can to give them access to resources. One of the programs that I'm most proud of is our School Success Initiative, where we're in the schools, we're working with our teachers, we're working with our counselors. A number of our providers are on board with that, just really servicing the whole child, head to toe. Dr. Vitti talked about, access to dental, access to whole health services, but more importantly, access. And so we're using our mobile crisis vehicles. We have a mobile clinic that we're rolling out to our community to destigmatize this notion of mental health and making them feel okay about access, right? Just coming in and having a conversation. we were at the Detroit Zoo at our mobile clinic most recently, and just to be able to interact with kids and let them just get on the bus, if you will, and ask, hey, what is this?
Yeah.
And talk about, mental health services and what derived from that were really some very interesting questions from the kids. What happens if you're depressed? What happens if you don't feel like getting out of bed some days? And just to be able to have a simple conversation that, listen, if there are things that you need, we're here to help. If there's access that you need or you want to talk about some things, we have that for you. We have a youth council that we engage and we listen. It's a listening session for people my age, not a direction session, which sometimes we tend to do with young people. We let them drive that meeting and let them have that conversation. So it's about access.
Yeah. Well, I appreciate all three of you coming to talk with us. It sounds a lot like it is de-siloing, organizations, and also meeting folks in the moment where they are, not just at school, but in community as well.
Right.
Yeah.
Absolutely.
Thanks for the work. We are heading back now to the main stage.
Conference.